All right. Well, I want to welcome everybody who's here today. You're welcome to, please keep yourself on mute for the presentation. We ask that you do hold all your questions until the end. For those of you who don't know me, I'm Claudia Bender. I am the president of the Estate Planning Council for this year, and I am very excited to introduce Joan Harris. Joan Harris is the founder and managing partner of Symphony Care Management and a fellow of the Leadership Academy of the Aging Life Care Association, which is a distinction held by only a select few nationally certified care managers across the country. With more than 4 decades of experience in elder care, Joan has dedicated her career to empowering older adults and their families through advocacy, creative care strategies, and proactive planning. She is the creator of Aging GPS, Goals, Priorities, Strategies, a specialized program designed to help older adults navigate the aging journey with clarity and confidence. Please join me in welcoming Joan Harris. Go ahead, Joan. I'll turn it over to you.
Thank you. It is so great to be here. I am really thrilled. I'm going to share my screen, and there we go. And I'm going to shrink everyone. So thank you so much for having me. I want to acknowledge that a member of our team, Christine Callahan, is on this call based on Cape Cod. So let's get started because we have a lot to cover, and I want to make sure we get to the heart of, hopefully what's going to be really beneficial to you. So thank you again for having me. I really have a mission at this point in my career to really educate people who we are and how we can help so we can get to people sooner and make sure that we're able to guide people and have them avoid a lot of the pitfalls of aging. And that really is our mission. So what I'm hoping today is that we can give you a deeper dive into kind of how quickly we are aging as a society. I think you probably all know that. Really, who do we serve? What kinds of clients are we seeing? A little clarity about terminology because it is really confusing for everyone. All the terminology about the different types of case managers, care managers, elder care providers. I'm going to give you the example of a planning program in elder care with our program so that you have that construct and really who are care managers and how we're different and how you can utilize us is really what I'm hoping you're going to walk away with, as well as why does everyone need an elder care plan with their vision of their future to complement the financial plan that you're doing with your clients. So that is a lot. And because I think this presentation could go a little long, I'm going to kind of breeze through some of the slides to make sure that we have time for questions at the end. Okay. So one of the things I love to do with financial advisors is just kind of go through the red flags that this is kind of just a little bit of awareness on your part, the things that you really want to look for when you meet with your clients, who I know many of you work with over decades, just so that you understand that when you see these changes, you really kind of want to make note and then what you want to do about it. So gait abnormalities can really signify a health issue. I'm not going to read every bullet out loud. You can read it, but it can be a sign of a disease like Parkinson's disease or a cognitive impairment or an underlying medical issue. It can be a spinal issue, which really can impact the client's health and functioning. If you see changes in speech, difficulty finding words that the clients are substituting and they're not aware that they're doing that, it really can be a sign that they're having a neurological issue and they could benefit from a workup. Not that you're going to advise them, but it is a red flag for you if you see these kinds of changes. Clearly, if they are slurring in any way, this should be brought to the attention of their family and they should get some medical assistance. If you see that your client, you haven't seen them for 6 months or a year and they have significant weight loss, that really can be a worsening medical issue, or maybe changes in a treatment plan that they're undergoing. They can be depressed if they've had a recent loss, and that's a real symptom of depression. Or they could be having pain and it's not really being addressed by their primary care physician. Changing senses. If a client has low vision or hearing loss, which is so common in older adults, that really can diminish their interaction with family and friends. And it could be masking also dementia, but sometimes people assume people have dementia, which just means memory loss, if they are hard of hearing or they're not seeing well. So these are things we really want to pay attention to, because they also are risk factors for dementia. Let's see what other. So if really you're going to notice if there are behavioral changes, if clients are frustrated or they have a flat affect, they're interrupting conversations, they have a short attention span, or there's really no carryover from your last meeting, and that's really unlike them. That can be an undiagnosed depression, mental health diagnosis, or cognitive impairment. So, what do you do if you're seeing some of these changes, which really today, these are just red flags for you to pay attention to? Um, Clearly there are many things that you might notice, and this is something that we see commonly in clients, especially victims of scam. We have a client right now who is a retired physician and has lost thousands of dollars due to scamming, and we're seeing more and more of that. Um, because scammers are preying upon older adults and also people who have impaired judgment. So the bottom line is if you're seeing any of these red flags with your clients, you really want to reach out to a trusted family member or a responsible party for your client and suggest that they talk with the primary care, or you can contact an aging life care professional, which is our formal term, um, and just see if they need some guidance, because we understand it's not your role, but it's also really good to just be aware. Okay, moving on quickly. Um, I think everyone is really aware that we are just in a tsunami of aging, and I updated these statistics not too long ago, and I still find them astounding that the projections in 2030, 71 million people, which is over 20% of the population, to be over age 65. The key takeaways really are that the 65 plus population is nearly doubling from 2010, 40 million, to 2050, 82 million. So it just brings home these statistics, the fact that the people who are planning for their aging with this tsunami coming are just going to be so much better off. The other thing I think is really important to make note of is that it isn't a matter of if people are going to have decline, it is a matter of when they are going to have decline. So, vision, hearing, ambulation, and fall risk is really a significant factor for people having difficulty in their daily life and needing assistance. So, people in the 85 and up category, except for a small number of the who we call the super agers, the people that you may see on TV or on Instagram, social media, that are just, so robust. That is a small cohort. But as we age, we are going to have more difficulty with cognition, decision making, concentrating, taking care of ourselves, and living independently. So these statistics show us that we really need to plan. Okay, so who are aging life care professionals? Who are we as a profession? Um, There are different names for us. We used to be called the geriatric care managers. GCMs is kind of a shortcut name, or care managers. And we typically call ourselves care managers. What's different about aging life care professionals, and no one really knows that term, is that we are nationally certified. It is a very high bar, and we live by a code of ethics and standards of practice. The primary factor that makes us different is we only work for the older adult, no matter who hires us. So we could be hired by the families, which is very common. And certainly our lens is 100% focused on what is in the best interest of the older adult. That is our client. By supporting our families or the primary people that are in their lives, we are working in our client's best interest. So building very robust relationships with our families and with all the professionals that are engaged with our clients very holistically is in the client's best interest. But this is client-centered focus. We are always looking at what is in the best interest of the clients. So you can read more about us on aginglifecare.org. And what's really interesting about care managers is that we're all different, just like any type of consultant. You've had your journey in your career, and every care manager brings to this consulting role, because we are private consultants, our own unique lifetime of experience and knowledge. We could be social workers. I'm a social worker by trade, nurses, PT, physical therapists, occupational therapists are now care managers as well, or people who just have that expertise and certifications in geriatrics. So what exactly do care managers do? Well, first and foremost, I think it's really important to say the word advocate. We are fierce advocates for our clients, whether that is they're discharged from the hospital, they're not ready. We want to make sure that they're not being prematurely discharged. We want to make sure that they go to the right, best, excellent rehab facility or home with the appropriate services. We understand the language, navigating all the different systems surrounding our clients that is extremely difficult for the consumer to understand how all of that works, especially if their family and they're emotionally engaged with their loved one and there is a crisis, or the older adult that's having a health issue. It's very hard to navigate all these systems. So as the outside objective expert who works for the client, we are often jumping in to a crisis situation and really kind of understanding very quickly what the situation is, what the client needs, and helping our clients and families to understand what their options are so then they can make really good decisions. So I think it's really important to note that as care managers, we are not decision makers. We are supporting our clients and families to make decisions, and we do not ever get involved in their finances. That is a very hard guardrail boundary. Now, we do need to know, excuse me, um, kind of ballpark what their income and assets are when we're doing a plan or trying to look at what is sustainable for them as part of their plan. But we never engage in anything to do with their finances. I think it's important to know that people typically and traditionally come to care managers when they're stuck. The families are often they've done everything they could possibly think of. They've brought in some services to the client's home, and things just aren't working, and they're worried and they're stuck, and then somehow they find out about us, and then we come in. If I had a nickel for every family who said to me, "I wish we knew about you years ago," I would be long retired by now. And I think that doing a plan ahead of time is something I've done over many years, but I just only recently gave it this name, Aging GPS, because as I said in the beginning, my personal mission is to get to people earlier and so they can understand what's out there for them and start to think about the steps they need to take to prevent proactively many of the problems that can happen. All right, so how do we go about this? This is from our association. It's a nice little slide. It just talks about many of the things that we do. And one thing I do want to note is that as a social worker and care managers, typically, we are mandated reporters. So if we see any kind of elder abuse, that could be financial abuse, exploitation, an elder at risk, any kind of neglectful situation, we are mandated to report it to the state of Massachusetts. All right. So that is kind of in a nutshell, care management. But how do we do that? We come in, we collect information, we typically do a home visit, and we start to talk and educate our clients about services, or we're jumping into a crisis and also doing that as well. So, to give an example of how practices are so different, my journey with care management over the past 18 years has been very traditional, problem solving, putting in services, helping people age in place at home, helping them move to assisted living, having that backup plan, taking clients to doctor's appointments and coordinating their medical care. And when I went out on my own about 8 years ago, I decided that I really wanted to help people to really have a better quality of life. But when you're first starting up a practice, you're very busy taking care of your clients. And I'm really excited to say that now we are offering a little bit of a different program, especially on Cape Cod. So why do I have this picture up here of these three beautiful Japanese women? To take a little sidetrack here, last May, I went to Japan with my Association of Care Managers for a longevity and positive aging journey, and it was life-changing for me. Not only did we spend time in Kyoto learning about the Japanese healthcare system, touring chronic care facilities, and really understanding the culture of how they care for their elders, we spent time on the island of Okinawa in the blue zone. And I don't know if anyone, we have it in our resource sheet that we're going to be sending to you. If anyone knows of the blue zone, Dan Buettner, who is a researcher with National Geographic, has kind of coined the phrase. But the blue zone is really a term for the blue line, dotted line, to 5 different regions in the world that they are studying why our elders are not only living long, but living really healthy and well and robust lives. So when I was in Okinawa with these amazing elders, it really occurred to me that although we do as care managers everything possible to help people age in place well, we can do better. So our shift has been to whole life wellness, the heart of our practice. How do we bring the joy and purpose and meaning back into our clients' lives? These 3 ladies that I met, I know it looks like a stock photo, but I met these 3 ladies. They take a walk every day to visit their friend who owns a restaurant and was cooking an authentic meal for us. They have joy in their lives. They are not old in their culture. And so the beauty of care management really is that we can, every practice is a little different, support our clients' quality of life, reduce pain management, help their sleep, re-engage them in their community, re-engage them in activities that they love. There is so much that we can do proactively to make sure that our clients have a good life. And I think that is the goal of most care managers. I do want to say one other thing about our association. There are 2,000 care managers across the country who are certified by our association. It is a very robust, tight-knit community, In fact, I believe one of my colleagues that I have great respect for is on this call. And I think it's really important to know that we are, if you walk away with nothing else, a tremendous resource for you as advisors who care deeply about your clients, and as well as for our clients and your clients and their families, because it is getting harder and harder for our clients to navigate. Okay, so that's the blue zone. That is incorporating wellness. So what is Aging GPS? What we want our clients to do, and I think it is very much in parallel with what you do as advisors, is we want them to think more deeply about what their vision is for their aging. Many people kind of have their head in the sand. They don't want to think about it. I don't want to talk about being old. But if they can sit down and we can do these exercises to really think about what does that look like for you? What are the things that you really want to be doing? Where do you want to be? What does it look like? Then that's really where we start. So a full assessment means that we do a life narrative. We want to understand who people are, what they love to do, what they feel they're no longer doing, um, and really understand their health, their cognitive profile, holistically everything about them. And I think the bottom line is when you have someone like Christine Callahan, who's on the line, 30 years in elder care, and everyone else in our practice, and when you have experienced aging life care professionals, when we understand our client and we make that connection with them, the path of what's going to be helpful for them opens up. We know what's out there for them. So this plan really looks to bring together all the aspects of the things that are important to life, including wellness, and a wellness consultation will be included in every one of our planning program consultations. And then we put it to paper. We do the assessment, we understand who our clients are, we do the home visit, we do a little research. If they're a little outside of our area, we want to know who the best vetted providers are. And then we write up our recommendations, send it to our client, and do a follow-up email. And usually the families are included. And as you know, families are very much scattered, often throughout the country and sometimes not even in the country. Once people have the chance to really read specifically the why behind we're making these specific recommendations and ask the questions, and they understand what we're recommending as a fit for their unique needs, then the next step is really to explore further some of those things that they want to learn about more, whether it's a backup plan for a retirement community or how they want to age in place at home, and then to go to hand it off to their financial advisor, because we can make really good recommendations, but really your piece in terms of looking at the financial viability for what they want to do with their lives is really the critical piece. So I'm giving some examples here, and I know it's a little hokey with the highway, the GPS and the highway, but it just gives you that there are some paths. So typically we meet people and they want to age in place and they want to understand how. What are the services out there that we can layer in to provide the support? Now, maybe they don't need that today, but what I have found in doing this program is people are nervous. Their kids don't live near them, or they're solo agers. They don't really have much of a support system. And yes, they're okay today, but they're nervous about, what tomorrow is going to bring. And so we talk about all these different types of supports that are available to them, and we bring to them our best vetted, best of the best of all these different types of services. And I think that's a really important piece because it's very hard for the consumer to know quality. And so it's really important to them, to our clients, that we give them peace of mind and say, here is, a companion agency we use all the time, and here are all the things they can help you with if you don't yet need personal care services. The second highway is retirement living. How confusing is retirement communities for our clients? There's a lot of terminology. So we have this whole session we do, which is kind of what is what. And it really is, once again, a financial piece. It depends when people come to us. Many times, when it is not aging GPS, when it is care management, people already have needs. They haven't done the planning. The window of opportunity to go into an independent living, continuing care retirement community has passed. And an assisted living is really what they need, or even a memory support program. So not only do we help people understand what things are, but we also help them to understand what questions they should ask when they tour. Do they want to have that as a backup plan if aging in place at some point in time at their home is not working? Where people are very stuck is with cognitive impairment. And I would say for traditional care management, where people are really already having needs, probably 80% of our clients have some form of cognitive impairment. And I think when we talk about a life-changing event where we can pivot, this diagnosis of Alzheimer's disease or a related disorder, because there are many different types of cognitive impairment, is the life-changing event. And this is where people are stuck. Mom is at home. She is not remembering things. We're worried about her. We're not sure if she's shutting off the oven. What do we do? So those are the cases that we come in really quickly and really understand what the client needs, and then help the families to vet the resources. If it isn't private care, if it is a memory support program. And then the key piece is, how do we get her there? The implementation of the plan. One of the beauties of being able to get to people sooner with a plan, with the idea to do a plan, is that when we pick up on mom just has a little bit of memory loss, ding, 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 that is our red flag that there may need to be a workup to really understand what path that person is on. Is it a memory disorder, or is there a reversible cause of their memory impairment? Depression, thyroid, God forbid, brain tumor. There are multiple reasons why people can be having worsening memory disorder symptoms. So if we can engage earlier with people, even if it is just to do a consult and a plan, and we pick up on these things, what every professional in our field knows, that when people are experiencing memory impairment, the sooner it can be diagnosed, worked up, and treated, the better the outcome, the slower the progression, and the better quality of life. There is more and more that we can do to support people with memory impairment. So in our practice, somebody could do an aging GPS plan and say, thank you very much. You gave me all the information I needed. We're now going to kind of, put some of these things in place that you can, advise us on. But at any point in time, if there is a new diagnosis or a life-changing event, all they have to do is pick up the phone, and we will be there for them with care management or whatever services that they need. So I think that's the beauty of private consulting and care management, is that we can step in whatever way is helpful to the client. So we're doing pretty good on time here. I know I'm going fast, but we have a couple scenarios, because I think telling stories, and these are true cases, is a good way to kind of solidify some of the things that we've already gone over. So Mary and Bob, a financial advisor referred a married couple, longtime clients of his, to our practice to come up with a plan. Mary and Bob lived in their longtime home in a suburb of Boston near one of their daughters, and Mary was completely independent and the primary caregiver for Bob. Bob was frail and had an undiagnosed memory impairment, probable Alzheimer's disease. Mary was exhausted from caring for Bob and could not get him to understand why he needed to use a walker prescribed after a recent fall or to take his medications. He was resistant to personal care and consistently agitated and angry with his wife. When we spoke, he could only talk about his past career as if he was still working. I could not bring him to the present. That is a hallmark of a cognitive impairment. And it was really clear to me that this man was failing and suffering, and his family really was in dire need of understanding what they could do to help, and they were really stuck. So Mary, which is unusual, but Mary wanted out of her big house, and she wanted to be in a retirement community that would take care of Bob, where she could make friends. She was really isolated at home with Bob. So what was the care management plan? So first we had to collect medical history and information. We did the assessment where I met with Bob and Mary and their daughter. I want to add that the most important thing when we meet a client, no badge, no papers, is to make that connection. That is everything in our work, as I know it is in yours, because from there, they need to feel this person hears me. They're not going to make me do something I don't want to do, which may not always be the case, but this person hears me. They want to hear my story. They work for me. I can trust them. I can work with them. So that home assessment is a really pivotal piece in our work together. So then in this particular case, we really needed to move fast. And because this gentleman was very impaired, I got on Zoom with the two daughters and with his wife to say, look, I really think this is what we're looking at. Here are my recommendations. These are the urgent actions we really need to help you layer in place for Bob's safety. But most importantly, here are the gold standards of how we're going to work around Bob's resistance. And that is the pivotal piece that they needed from us. They needed to stop trying to get Bob to their reality. We needed to go to his. And we really were always going to lose if we were going to try and reason with Bob, because part of memory disease is that people cannot see their own, they have no insight to their deficits. I wrote up my recommendations for the assisted living communities and sent the costs to the financial advisor. I assisted the family in touring and really, really helped them to understand what they were looking at. They made a choice. We then moved into an implementation mode of a smooth transition for Bob, because change is tricky when someone has memory impairment. And they lived in that particular assisted living community for a couple of years before Bob passed away. He was very comfortable. He had the support he needed. And the family and his wife were able to really be there with him, but not be his full caretaker. So that is kind of a classic care management case. This second scenario really is a pivotal case for me with aging GPS, because it turns out that some people don't want me to just hand off a plan and go have their life and implement everything. Sometimes people say, okay, we did all this work together, but we feel that you could be a support to us. How can we stay engaged with you? So we're going to go through this quickly, and then we'll talk about how we stayed engaged with this couple. Jane and Michael are independent active seniors in their early 80s, living in their large home in Harwichport, Mass. Well, they both have many hobbies and engaging activities, social groups, and a strong relationship with their medical providers. Their adult children live out of state. This is probably, 80% of your clients on the Cape. Jane and Michael came to Aging GPS to proactively understand the resources available to them to keep them aging well in their home. Jane is a cancer survivor and has chronic back pain. Michael has low vision and is significantly hearing impaired. They were nervous, there's that word again, about the what if scenarios. Jane is a retired internist and Michael was was in the real estate profession. Although they have significant assets in property and investments, they still worried, is it enough? So, what we were able to do is really understand everything about each of them, what's important to them, go to their home and see their environment so that, again, we could build that relationship and really work on the goals. Wrote up an aging GPS plan, Zoom call review, aging GPS with the clients and their families to determine next steps. This particular couple, I see them quarterly. They always have questions and concerns, and they want to be very proactive. And that has evolved into a very preventative quarterly visit for them. But these were some of the things that we worked on. How could they make their home more accessible? They wanted to understand what was available under their Medicare services. They wanted to know what the car services were so that if they weren't able to drive, what would be available to them. They actually did a great deal to their home with well vetted home accessibility people to come in and modify some of the things about their home to allow them to age in place. And then technology. Technology is huge when it comes to aging in place, making things more accessible. And we certainly learned that during COVID. And then meal preparation. This couple actually has felt that the chef services that they have delivering about 4 dinners for them a week has been life-changing for them and taken a lot of burden off of them. And then they wanted to know that if they had medical needs beyond what a private, non-medical home care person could provide them, where could they find private duty nursing? We vetted a backup plan with them in terms of the CCRC. We did the whole 9 yards of touring communities and understanding what was available, every level of care. And then the why behind why one would be a best fit for you versus someone else. And what was really interesting after they visited all 3 communities, they got on the wait list for one community as a backup plan because this client decided that if her husband died, she would not want to stay in the house, and therefore she wanted to be on the wait list. But they decided that ultimately, after doing this exploration of the retirement communities that they were very glad to have vetted, that they were going to age in place in their home, and they wanted Symphony Care Management to be there for them if, God forbid, something came up and something changed, or they went to the hospital and they needed discharge planning. So I think what's really important, a lot of information at once, is to understand that there are so many things that we can do for people, that we can support their education about what's available so they can feel empowered to make really good decisions. And that runs really parallel with their financial plan. And if you do walk away with anything today, I would say that it is never too early to start a plan and to really understand what's available to you. Life has a way of happening, and I'm sure everybody in this room knows that. And when you're in the middle of a crisis or a healthcare change, you cannot educate yourself on to what's available. So in our particular little practice of 5, we are focused on quality of life and wellness, planning, care management, and dementia care. And the way that I have grown my practice is bringing in people with different types of expertise, but all have the passion and the knowledge for working in this amazing field. Thank you. And this is a resource sheet that I love to give because it just has a little smattering of some really interesting things to think about when it comes to aging, as well as some really critical resources. I am going to stop share. My goodness, I did get through that pretty quickly. And I am absolutely happy to take any questions. And I think Claudia was going to um, call on people. I'm happy to talk about any of the information or any questions that you have.
And if you want, you can either raise your hand, or if you prefer just to throw the question in the chat, we'll be monitoring it there. So please let us know. I think, Joan, one of the questions that I have is, what are some of the biggest, I guess, or most common situations that you run into that are obstacles for people to even ask for care or help?
So I think the biggest obstacle for us is people don't know about care managers. So I think a lot of families are just out there on their own doing the best they can because they don't know that there's help available. Even if we work with people for a very brief amount of time, to get them through a crisis, to do a placement, to give them a consultation. I think the obstacle is that we are not known. And I mean, has anyone ever heard of the Aging Life Care Association? I mean, it's kind of a word that people don't have. I think people know care managers, but they get that confused with case managers who are hospital-based and they're insurance-based. So I think there's a lot of confusion out there, and they don't know that there are advocates who can be with them short term to get them over the rough spots or over the long term through end of life care. And so that's why I'm so happy to be here. If people walk away with the knowledge that, they can give their clients the Aging Life Care Association. And people can read about, gee, these are professionals. I can put in a zip code, and all the vetted care managers in that zip code across the country will pop up, and I can decide by calling them who in this field is a good fit for me and my family. So I think it's really just the knowledge that you don't have to go it alone, that you can build a partnership is really the biggest obstacle.
And I would say, too, one of the biggest pushbacks I get is, oh, we don't need that, or we don't need that right now. That's another one. And then they wait till they're in crisis mode and they're like, oh, man,
Yeah.
I need help.
Yeah, I mean, that's why care management is our core business, because people are waiting until, it is hard sometimes for us when we get people so far down the road that we can support comfort in end of life care. But sometimes there's not a lot we can do. We have clients who have little money all the way up to very wealthy. And I think one of the things that I sometimes am able to help with when the kids hire us, they hear about us from their elder law attorneys. We get a lot of referrals from trust and estate and elder law attorneys is, mom has too much money to be eligible for any entitlements, but she may not have enough to take her all the way. They don't know that there are some low and moderate income assisted living. For us, it's just a different data point. But I think people are just fearful and they don't want to think about it. But that is the message, that have a consultation. You're not on the hook. You don't have to work with a care manager for any length of time, but knowledge and understanding is going to help you to make really good decisions.
Yeah, I agree. All right. I don't see any hands raised unless you raised your hand. Oh, good. Oh, yes, you are. Sorry, it blended in with your Buckley Financial. My apologies. Go ahead, Seth.
No, Seth, we know each other.
Hello, how are you?
Good. How are
I'm
you?
I'm sorry, my dog is going crazy in the background. Hold on 1 second.
It's always the worst, right? Probably heard talking and was
Yeah,
like, wait a
Joan, it's
minute.
great to see you. I mean, awesome presentation. I'm
Thank
wondering
you.
how families engage you. Is it kind of an hourly? Is it project based? And in particular, um, thinking about my mother, who's 92, lives independently, drives. I mean, she's amazing for a 92-year-old, but she's 92.
Yeah.
And my sisters and I are trying to figure out kind of, what her options will be going forward, and at what point we make some hard decisions.
Yeah. So with care management, I can say pretty much across the board, it is an hourly rate. Every practice is different. In our practice, we break down, kind of like lawyers, we break down our time into 6-minute increments. Um, the scope of work is always really clear. So there's never any surprises for people. When we finish that scope of work, we then have a discussion. Okay, we're here. We recommend this. Maybe we pull back to monthly monitoring visits. What would you like to do? So there's that constant conversation, and it is an hourly rate. With aging GPS, I am going to now switch very shortly to an annual membership, because that way we can do the quarterly visits and really keep for those people who want to, and we can do the consultation and see people quarterly, and it just makes sense for a lot of people. Or they can just do a one-off plan, and there you go live your best life. So every practice is different, but I would say nationally, care managers operate hourly rates, um, and the terms can be different. Some practices will ask for retainers, ours does not. So we're all small businesses. We're all social workers and nurses and different kind of healthcare professionals kind of figuring out our business model, but that's really the most common. And I would say for someone like your mom, who sounds amazing, what we know is that when someone is in their 90s and they have a health event or a fall, they do not have the bounce back that they would in their 80s. And this is the perfect time to really empower you as a family to know kind of you have everything in place that you need if you need it. Like now is the time to kind of understand, look, mom wants to stay in her home. So now I know the best vetted providers, or if she goes to the hospital, I can call a care manager to help us do discharge planning to make sure that goes well. So I think you're sitting pretty, but the reality is that something will happen and she will start to have decline. So now is the perfect time to maybe build a relationship with a care manager, even if they don't need to be doing a lot right now. And for out of state families, this is pivotal to have boots on the ground and to know that someone is there for their loved one. But even for families that are in the area and very engaged, families go on vacation. We act as backup. If God forbid there's an emergency, we go to the emergency room. We are never decision makers. The doctors are going to call whoever the proxy is. But getting in now kind of could reassure your family, okay, we got this. We don't have to live in fear, like when something's going to happen.
Great, thank you. I'll follow up with you and Christine.
Well, it's nice to see you.
Joan, I have another question.
Yes.
You and I talked about this previous to this meeting, and then you brought it up again about the blue zones. I think, what are some things we can be doing today, not as, elderly folks, but just for ourselves and for our families to kind of help us prepare for the aging process?
Yeah, so I think one of the real differences that I saw, and actually, if you go on my website, there is a video of the 93-year-olds at the day center that we went to doing a traditional dance for us. And we're dancing around them. And honestly, we look a lot more disabled than they do. Like It was mind blowing. So I think the biggest message is how we think about old. Like that is not actually a word in my vocabulary because keeping people, older adults are isolated. They they lose their communities, they lose their friends, they move to be closer to their children. They lose so much, and they can be in an independent living community and still be really isolated. So I think in keeping people and keeping yourself engaged in meaningful activity and building your community that you can keep, having that purpose and that reason to get out of bed. It's not just eating healthy and exercise. It is, for example, this woman who made us a traditional Okinawan lunch. She was probably in her 60s, and she's still doing everything that she did when she was in her 20s. There's no like, I'm 65, I stopped working. So you may want to stop working when you're 65, and your clients might, but what are the meaningful communities and engagement and purpose that you have in your life that isn't specifically tied to your career, and rebuilding some of those sense of community if people move, so that people don't feel those losses and isolation. So what we're finding is that many of our clients can't do a lot of the things they used to love to do, but they can do them in different ways. And we can bring back that sense of community and engagement. And I think that was my real takeaway from the Blue Zone. I mean, you're not old till you're over 80 in the Blue Zone. And they do a parade, and they like celebrate that you've turned 80. So I think that's the whole mindset that you know, it's just a continuation of your life. It's not like the end of something.
Fascinating. Thank you.
Yeah. I would recommend reading his book. And I know there's a lot of information about longevity out there, but I think, again, each of us are unique in the cognitive, physical, spiritual, financial, all the different realms. So what we try and do is really look at the wellness of the whole person and all those factors. Yeah.
That's great. Thank you.
Yeah,
Great.
of course.
Any other questions? I don't see anything in the chat. Oh, go ahead.
Yep, I had a question. Yeah, I'm not Heather. I'm Rob.
I was going to say, you don't look like a Heather.
On my wife's computer. I apologize.
Nice.
So I work in the emergency room, and I see your first. Thank you for your talk. Very informative. Your first scenario, Bob and Mary, I see almost every shift in the emergency department, and it's usually a crisis, sometimes agitation. And our case managers, as you pointed out, with the insurance, come up with a quick fix, but they need a long-term play, and your service certainly does that. How can you quickly mobilize in these acute settings for somebody who needs more than just a Band-Aid?
Yeah, so first of all, we're pretty good at putting up our hand and saying, this person lives alone, they're not safe, you can't send them home. So we're kind of that person who is saying, just give us, we need a little time, and we will typically be able to get 24/7 care in with the client for discharge if home is appropriate very quickly. With my aging GPS clients or all our care management clients, if we have a married couple and one is the caregiver and the caregiver ends up in the ER, we'll have private care in with the loved one they take care of within an hour or two. So for the clients we're engaged with, the plan is there and we just implement it and we run. But for clients who are in crisis and they're not on board, we can very quickly advocate for them. Do they need a PT assessment in your ER? Is it appropriate for them to have a short-term rehab stay? Do they need, what is it that they really need? But if it is going home, then we'll transport them. We'll make sure that the services are set up in their home and we'll catch up with some of the paperwork later. So we can jump in really quickly, but we are also, you know how, I mean, you're in the ER, it's chaos. So we're sometimes 8 hours in the ER with them. Like our clients should not be alone in the ER. They're just not places where we can have them alone. So I think what people don't know about care managers is we can be consultants, but we can be very boots on the ground, and we're going to be with our clients where they need us to be. Yeah. Have you met any care managers in the ER?
A couple have come in, but usually
Yeah.
it's our folks. I work overnight, so I don't meet
Overnight.
many outside services.
Right. Right. Yeah, I mean, we really want to build that good partnership with the case managers in the hospital and work together. We're out in the community and they're really under the gun to get that person out of the hospital if they don't qualify for acute level of care. And we understand that.
Sure. Yeah, they're overwhelmed, and I think could appreciate any extension of their services.
Yeah. We try. If we can get them to talk to us, we really try and work together. Yeah.
Much appreciated.
Yeah, no, it's nice to meet you. Well, can I just say one other thing? I know I threw a lot of information at you, and if people do have questions, in our practice, we're a resource for all of you. I will always connect people with a care manager in our network that's outside of our area. That is my pleasure to do so because we will only, take on clients we know we can truly serve. So if you do need that referral, if you need just some understanding of what direction to go in, I am happy to hear from you, and Christine is as well. So, definitely feel free to reach out.
Great. Thank you so much. We really appreciate you coming, and I hope everyone has a wonderful rest of their day.
Thanks for having me. Great to meet you all.
Thank you.
Bye-bye.
Good day.